So I have spent an enormous amount of time at this particular point scouring the internet, talking to people, talking to colleagues, talking to other healthcare professionals, and I've really condensed this down to three main things or concerns that we need to consider as a community. Number one would be the epidemiological concerns. So at this particular point, you've probably all heard a concept called flattening the curve. And really all that really points to is stopping the spread of the virus, because it does have the potentiality to overrun our healthcare system, whether that be through a lack of supplies on hand, or a lack of hospital beds, or God forbid, a lack of personnel, not only to take care of the people who are affected by it, but the people who already have life-threatening issues that they're already dealing with, aside from. So these are real considerations, real problems, so keep that in mind as things come down. The next thing would be the immunological concerns. And that really stands with how deadly is this virus? And from every resource that I'm seeing, from the NIH to the CDC to the Florida Department of Health, they are stating that the majority of people who are healthy will recover. Now, that does not mean that it's not important, because every life does matter, every person matters, and we have seen at this particular point that immunocompromised individuals are more susceptible, and people who have chronic health conditions already are more susceptible. So we need to keep in mind that the things that come down are not just for you and I, but they're for all of us collectively as a community, because we are all in this together. So that's a real concern and things we need to consider as well. But building on that, the CDC also states that at this particular point, there is no treatment for it. So what that means is your best opportunity, your best bet, the way to position yourself the most is to ensure that your immune system is as strong as it possibly can. And if it's not, figure out how you can help support that system in this time of need. Which brings us into really preparatory measures. And these are questions you need to ask yourself. How can I help my immune system thrive, improve, boost? And then what can I do to prepare? So I wanted to come on here and give you those three considerations. We will be back, and I'll give you some resources with regard to things that you can do to prepare, to position you and your family for the best possible outcomes. Once again, this is Dr. Drew with Arc of Life. We say your purpose is our passion.